Pay close attention. What you're about to see is Bible prophecy being fulfilled.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Yeshua Hawkins, where we're going to talk yet once again about the United States and Russia, but this time they're in a standoff over Syria. You know, they've both been active players in that region. Well, now it's regarding the humanitarian crisis there. And we're also going to take a look at what the Pope has to say about COVID-19 and vaccines. Well, like we mentioned, the U.S. and Russia are in a standoff concerning the humanitarian crisis in Syria as far as who's responsible for it and who's better able to implement a solution and how. Well, the U.S. and Russia actually agreed that the situation in Syria is getting worse while attending a virtual UN Security Council meeting. Mark Lowcock, the Undersecretary General for Humanitarian Affairs, estimates that there are about 13.4 million people across Syria who need humanitarian aid, 20% more than last year.
Wow. Well, even though the decade-long war in Syria is somewhat calming down at the moment, the worsening economic crisis coupled with COVID-19 pandemic has created a concerning humanitarian problem in the country. Now, since both the U.S. and Russia are active in Syria, they clashed in regards to solutions to the Syrian troubles. The U.S. wants to open borders to deliver humanitarian aid, primarily areas held by rebel forces.
That's right. The U.S. Secretary of State Anthony Blinken said, quote, "The lives of people in Syria depend on getting urgent help. We have to do everything in our power to create ways for that aid to get to them, to open pathways, not hinder them. The members of this council has a job to do. Reauthorize all 3 border crossings to bring humanitarian assistance to the Syrian people."
Well, Russia and China vetoed measures for those proposed border crossings in July 2020. Now, the concern is that the cross-border aid initiative infringes on the sovereignty of the Syrian government and allows for the possibility of more than just aid reaching the rebel parts of the country. Now, Mr. Lowcock said the UN cross-border operation is one of the most heavily scrutinized and monitored aid operations in the world. That is because the people paying for it will only allow the opening if they are sure the resources are not being diverted to terrorist groups.
Well, some have complained that the donor groups are the same ones that supplied the terrorist groups with weapons previously. Russia's proposal is that all aid go through Damascus, giving the Syrian government control of the aid within its own borders. Moscow also criticized the U.S. over Syrian sanctions and confiscation of Syrian resources. Sergei Vershinin, the Russian deputy foreign minister, brought to attention to the council that the U.S. has transferred 300 tankers of oil and 200 truckloads loaded with grain out of Syria into Iraq, and this was just in one particular occasion.
Well, while the U.S. and Russia might not agree on how to handle the Syrian humanitarian crisis, both powers agree that something needs to be done, and soon.
Well, have you wondered what makes the coronavirus pandemic different from past pandemics? Why is this virus such a great threat to society as we know it? And why have scientists and doctors, what have they learned so far? Well, take a look at this interview from the Korean Times with Dr. Hakim Jabala, a virologist who specializes in infectious diseases.
Thank you for your time today, Dr. Jabala. Let's get straight into the virus. So how much do we know about this COVID-19 virus?
We are beginning a completely uncharted journey with this virus. We don't understand a lot because the behavior is completely different. I was very surprised at the outbreak in China, the numbers of people that were infected in such a relatively small period of time. It's very unusual. There are so many talk out there, but it's not following the same rules as the other viruses. This virus is much more aggressive and much more lethal. With this virus, it's not very clear. It's actually very disturbing. There have been some interesting reports that they've had people who were sick and they were cured. They released them out of the hospital and then they got reinfected. The truth is very simple. The assays that we do every day to test this virus, they can only test a certain limit. And if the virus level goes below that threshold, you're not going to detect it, meaning you're going to release the patient and say you're healthy enough to leave. What I find alarming is we are releasing all these patients, telling them they are virus-free, and they go back to the community. It's not your average SARS, it's not your average MERS. Many people, including me, we start calling it a very mysterious, very cryptic virus because we don't understand it, because we don't understand it, because we don't understand it, and it doesn't seem to only attack the lungs, it seems to also attack the heart, and it seems also to attack the liver.
So we're seeing interesting patterns. Not only old people or those with underlying health conditions actually develop this disease.
Now, the elderly are really the first category that get affected a lot because as we get older, our immune system declines. Between the elderly and the adolescent to probably 50, 60 years old, their lifestyles will dictate how vulnerable they are to a virus. Their lifestyles will dictate how vulnerable they are to a virus. Their lifestyles will dictate how vulnerable they are to a virus.
There's so many unknowns about this COVID-19, and China, the Chinese government, is responsible for this lack of information. Do you think this is actually becoming an obstacle for developing a vaccine sooner?
China is not forthcoming with a lot of this information. This information is coming in different bits and pieces, and I think there are some fantastic people around the world that are spending time dissecting that information and putting it together. It's not so much for developing vaccine, but to study the trajectory of where this virus is going. Right now, we're in the middle of a storm, and a vaccine is not going to help. Right now, we're in the middle of a storm, and a vaccine is not going to help. Their lifestyles will dictate how vulnerable they are to a virus. Right now, we're in the middle of a storm, and a vaccine is not going to help. Their lifestyles will dictate how vulnerable they are to a virus.
Well, Katan, a couple interesting things that Dr. Jabala said there, that a vaccine is not going to help. He said a vaccine is not going to help. And the second thing was their lifestyle will dictate how vulnerable they are to the virus. And that's something that isn't that widely talked about, the lifestyles that people engage in, but there are things that make them more readily susceptible to catch that COVID-19 virus.
Wow.
Well, at a recent Mass, Pope Francis tried to console all Christians who have lost loved ones or are battling COVID-19 during the pandemic. He also prayed for the doctors and nurses who he said are making a valiant effort. Now, the Pope said, everyone, especially the most vulnerable among us, requires assistance and has the right to have access to necessary care. This is even more evident in these times when all of us are called to combat the pandemic.
Pope Francis showed his support for pharmaceutical intervention, saying, quote, vaccines are essential too in this fight. I urge the entire international community in a spirit of global responsibility to commit to overcoming delays in the distribution of vaccines, end quote. But you have to wonder just how essential these vaccines are in the battle against coronavirus. Well, because we just heard Dr. Jabala tells us, quote, their lifestyles will dictate, like you just said there, how vulnerable they are to the virus. Well, right now we are in the middle of the storm, and the vaccine is not going to help, he said.
Right, so you have Pope Francis there, leader of Christianity. He's saying we need to get all these vaccines distributed as quick as we possibly can. But then you have the doctors coming out, the doctors and the scientists who are doing the research, and they're seeing they saw the second surge and the third surge and now the fourth surge, and they're realizing that these vaccines are not keeping up with how fast the virus is mutating, so to speak, and all these different variants coming out. So, people are going to look at that and see that it's a different message than what's coming out from the doctors saying a vaccine isn't going to help us.
Yeah, and in all of this, it takes, it's interesting that a doctor is saying, hey, look, it's the lifestyle that's going to determine it. Well, nobody is saying you need to change your lifestyle. In fact, many of the governors and leaders of communities are saying, hey, let's get back to status quo. Let's get back to enjoying life and doing what we used to do that we so much love to do, which we also saw in previous months that those activities led to what was called super spreaders of the pandemic. So only one person I know of is actually talking about changing your lifestyle so that you can protect yourself from getting this coronavirus. And if you do, what you can do to kind of, wade your way through it. And that is Yisrael Hawkins. Well, to find out more about what Yisrael Hawkins says about one of these, this coronavirus being one of the 7 last plagues, contact the House of Yahweh. And when you contact the House of Yahweh, don't forget to request your free copy of the monthly newsletter and the Prophetic Word magazine. Here's how. To contact the House of Yahweh, you can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas, 79604. You can call them at 1-800-613-9494. Visit them on any of their websites by going to Yahweh.com, YisraelHawkins.com, and Yahweh'sBranch.com. You can visit our website by going to YPNnews.com. You can email the House of Yahweh at info@Yahweh.com. And for all calls outside the United States, please dial the number on your screen. And as mentioned previously, don't forget the Yisrael Says and the Ask Yisrael programs that are available online for you to aid you in the study of the scriptures. And you can find those by going to YisraelSays.com and AskYisrael.com.
Well, don't go anywhere. Up next is Yisrael Hawkins teaching what you need to do to change your lifestyle so that you and your family can be protected from this first plague, the coronavirus, and the 6 more that are coming. Well, from all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.